I'm Jane, and this is the CareSmartz360 Bulletin. CMS released the CY 2026 Home Health Payment Rule, a delayed and much-anticipated update, last Friday. The agency projected an aggregate 1.3% reduction in Medicare payments to home health agencies compared with 2025, about $220 million less. That figure is notably smaller than CMS's June proposed cut of 6.4%. In practical terms, the final rule is expected to translate into roughly $915 million more in payments to home health providers next year, as per the National Alliance for Care at Home. Yet the Alliance stresses that even with these adjustments, the overall cut will still impact patient access and could drive more agencies to close, pushing patients toward hospital settings for care. Dr. Steve Landers, CEO of the Alliance, voiced concern. While CMS incorporated some industry recommendations, a 1.3% overall reduction in payments compared to 2025 will likely result in continued reductions in patient access, the closure of more home health agencies, and more patients waiting in costly hospital settings instead of recovering safely at home. Key components of the final rule include a net 1.3% payment change consisting of a 2.4% rate increase offset by a 0.9% permanent adjustment and a 2.7% temporary adjustment, plus a 0.1% decrease tied to an updated fixed dollar loss ratio for outliers. A permanent PDGM-related adjustment of negative 1.023%, adjusted after concerns were raised about post-2022 behavior changes being influenced by factors beyond PDGM, such as the OASIS E update, value-based purchasing expansion, and rising Medicare Advantage participation. A negative 3.0% temporary adjustment to cushion against a significant single-year payment drop and protect access to care. The rule includes a 0.1% or near-zero effect related to PDGM dynamics and a previous proposal that would have imposed a 9% base rate cut, which was not adopted. CMS notes that these changes come amid a broader effort to address fraud, waste, and abuse, with enhancements to provider enrollment procedures and related safeguards. Additional items finalized in the rule: a clarified face-to-face encounter policy, allowing flexibility in who conducts the encounter, regardless of certification status or facility of care. Revisions to the Home Health Value-Based Purchasing (HHVBP) model, updated low utilization payment adjustment (LUPA) thresholds, and recalibrated PDGM case weights. That's all for today in the CareSmartz360 Bulletin. Until then, have a great day.